To the staff meeting at Marina Hills Animal Hospital. Today's medical moment, we're going to talk about the patient that came in yesterday. You guys all did a really good job in a very difficult situation. This was a senior citizen Labrador who was completely fine and normal on his checkup 6 months ago with normal blood work, who seemed completely fine and normal to his owners up until about 24 hours ago, before yesterday morning. In the middle of the night, the dog was suddenly in distress. He seemed painful. He seemed weak. He was showing lordosis, which is where dogs put their elbows down at the ground and their bottom up in the air. That's what they do when their abdomen hurts. He arrived first thing in the morning before the doctors and was pale. And Shayna did a great job of getting an IV catheter in the dog, checking hematocrit. His hematocrit was 31%, so not normal, not terrible. But his color was terrible. I mean, this dog was collapsed and pale with poor circulation. A brief abdominal ultrasound found that he had free fluid in his abdomen, and a quick tap found that that fluid was blood. So this dog was bleeding internally, it was rapid, and it was severe, and it was life-threatening. And so we, quick like a bunny, took the dog into surgery, opened him up. We were hoping that we would find a spleen that was bleeding, because that's pretty common in Labradors and it's pretty treatable. However, this dog did not have a bleeding spleen. In fact, his spleen looked pretty normal, a little on the small side. Instead, we were faced with a belly full of blood, and we had to figure out where the bleeding was coming from. You guys know that in our surgery suite, we always have the patient's head over here on this end, right? So, and I'm on the far side of the table, the head's to my right, and the tail's to my left, right? So I make an abdominal incision. I know the spleen is on my side, on the pet's left, and on the right-hand side is the pylorus and the duodenum. So the first thing we have to do is to figure out where is this blood coming from. As a clue to figure out where to look, I looked at the omentum. The omentum, you've heard me say before, is like the dish rag of the body. That's this light, lacy, fatty structure that comes off the greater curvature of the stomach. And if there's ever area of an inflammation, the omentum will go to that area of inflammation and stick to it, increasing the blood supply. Well, it turns out that the omentum was stuck in the dog's upper right quadrant, near the area of the pylorus and the duodenum. So we just followed that down as we're sucking and removing large amounts of blood, which, by the way, we were able to save some and put it through a filter and re-administer it to the pet, because he was bleeding fast and he was going to run out of blood pretty quickly. So we were able to auto-transfuse some of his own red cells from his abdomen through a filter back into his bloodstream. Meanwhile, someone had gone over to urgent care and gotten a unit of blood, and of course we're giving electrolytes as well as volume enhancers as well as whole blood transfusions simultaneously while we're trying to stop this bleeding. What I found when I followed the omentum over to the dog's right quadrant was that it was adhered. Here's a rough sketch of what things look like in there. This is the kidney on the dog's right side. That's the caudal vena cava. The adrenal gland is right there at the base of the kidney. There was a band of omentum coming across, being adhered near the body wall, north of ahead of the kidney, and in order to see what was going on, we actually tied off the omentum and ligated it so we could go deeper, because we're getting deeper into the dog here. Once we did that, we found a mass up against the body wall on the inside, so deep, right, dorsal, and that mass extended cranial all the way to the level of the liver. That's the liver in my sketchogram right there at the top. It was actually adhered to the liver, and not knowing where exactly was originating from, we didn't know if this was a liver mass heading south or if it was an adrenal mass heading north. I decided to start at the liver end, and we actually ligated the liver because that was the place where I could get my finger around this mass. So with a ligature to stop bleeding, we tied off a section of the liver. Sorry, you're eating lunch. Anyway, that's what we did. And then continue the dissection, and we were able to get the mass with its liver attachment off the dorsal body wall and then start tracing it back. And as we traced it back, we got into this whole big mass that did connect to the adrenal gland. So I continued my dissection between the caudal vena cava and the mass, and I encountered some vessels along the way that we tied off. Here's a diagram up on the, a fancy diagram up here. We encountered the phrenico-abdominal vein, which goes across. I ligated that one. And then the big blood supply, it turns out, was, and they make it look like a little tiny swirly line in this drawing, but it was this vessel at the caudal end of the adrenal gland where it connects to the renal artery. And that was difficult. But we came back. When we got back there, we ligated it up with clamps, and then we had traction on the mass, and we cut the vessels, and it was cool. Nothing was bleeding. We had the tumor out, but then we still had to tie off. And that's when things got a little dicey, because it turns out that the traction of the mass was actually holding the caudal vena cava up out of the way. And when we no longer had that tumor as a handle, it got more difficult to access the vessels, which then suddenly felt like they were behind the caudal vena cava. So, but we got it done. We got him tied off. We got him off the table, and he did recover. Well, he did breathe on his own. He had reasonably good color. He did not continue to bleed internally. As the day went on, unfortunately, he developed arrhythmia, heart arrhythmias, that we couldn't correct, and he passed away yesterday afternoon. So it was a sad thing. It was a dramatic, right now we got to do this sort of a case, and you guys all did a really great job of your part. We gave that pooch every chance that he could have to get through this. The remaining question is, what kind of tumor was it? There are two common types of tumor of the adrenal gland. There are those related to glucocorticoids, like Cushing's disease, and sometimes those are malignancies that invade the neighborhood. That's the most likely type of tumor. There's a different type of tumor of the adrenal gland. The adrenal has an inside, a medulla, and a cortex on the outside. The other one's called a pheochromocytoma. That often causes ridiculously high blood pressure. When the dog got here, he did not have super high blood pressure. Whether he had that the day before, I don't know. But the biopsy is going to tell us for sure what the nature of that tumor is, and I'm very interested to know. This is not a surgery that I would sign up to do if I had the option, and anytime I have found adrenal tumors in dogs, I've referred this surgery to the specialty group. Even in the specialty hospital, there is 60% mortality in the perioperative period. So, this is, it was sad that the pooch passed away. Everyone did everything right. It's just a frustrating and really dangerous situation. And part of that risk comes from the mass and the bleeding, which we certainly experienced yesterday. Part of the risk comes from the hormones that are being released, either the catecholamines in the case of pheochromocytoma, or the glucocorticoids, mineralocorticoids in the case of Cushing's, can just wreak havoc on organ systems, because they're there in high levels, and then you do the surgery, and then they're suddenly not there, and the body was expecting them to be there. So it's both a surgical as well as medical, ICU, very critical diagnosis to have. Anyway, so that's the scoop on the sadly bleeding adrenal mass. Sad in that we lost the patient, but a success in that you guys did a great job and really jumped to and did a good job doing what we could. So thanks.